What are allergy shots? Subcutaneous immunotherapy, SCIT or allergy shots, is the injection of allergens to build tolerance that can help allergy symptoms, asthma, and eczema. Subcutaneous immunotherapy, allergy shots, has two phases, building and maintenance. Building is the first few months when we slowly increase allergen dosage to help patients' tolerance. When building is complete, maintenance phase begins and lasts the rest of the time on SCIT. Most patients feel some benefit within the first few months of shots, but rarely can take up to 12 months for results. Phases. Building. Every 2 to 14 days, whatever works with your schedule, and you can change the number of days between shots at any time. Usually, 2 to 6 months, but can be longer depending on reactions or frequency of shots. Once done, you move to number 2, maintenance. Maintenance. Every 14 to 21 days, whatever works with your schedule, and you can change the number of days between shots at any time. Usually 3 to 5 years, but some patients may continue longer. Required visits. Patients are expected to come in for an in-person visit or a televisit with a provider usually 2 to 3 times during the first year of allergy shots, then 1 to 2 times a year while on maintenance. Frequently asked questions.
Are there any side effects to shots?
Very common to have very large redness, swelling, itching at the injection site. Rarely, serious allergic reactions can happen.
Can I take medications, antihistamines, nose sprays, eye drops, inhalers, etc., while on shots?
Yes. Most patients do medications and shots, and as the shots start to work, they can wean off the medications themselves.
If I can't show up to my shot appointment time because of emergency or illness, what should I do?
Call or text our office to cancel your appointment to avoid a no-show fee. A no-show fee is an out-of-pocket expense that insurance does not cover.
What if I go more than 21 days without shots?
We will step you back a few doses depending on how many days past 21 days.
What if I go 60 or more days without shots?
You will have to restart shots from the beginning.
When do I need to call the clinic right away and/or use my epinephrine auto-injector and call 911?
Anytime you have a reaction that is outside of where you got shots, cough, shortness of breath, throat swelling, hives everywhere, dizziness, nausea, stomach pain, sinus congestion, itchy eyes, serious allergic reactions, anaphylaxis, can occur minutes to hours after allergy shots and can include the following symptoms but are not limited to these symptoms: throat swelling, sneezing or congestion, nausea or vomiting, shortness of breath, cough, wheezing, itching or swelling, dizziness, loss of consciousness, death, extremely rare. Rest assured, because here at Iowa Allergy, the staff is well trained in treating anaphylaxis, and emergency equipment is available in the clinic should you have a reaction here. Patients should wait inside their cars in the parking lot for 30 minutes after their allergy shots and come back inside the clinic if symptoms occur. Patients should always carry their epinephrine auto-injector 24 hours after getting allergy shots. If any systemic symptoms occur after leaving the office, patients should use an epinephrine auto-injector and call 911 or have someone else drive them to the nearest hospital. Patient can also call the clinic during business hours for advice. Pre-medicating with antihistamines is highly recommended and will help decrease large local reactions as well as severe systemic reactions. Please see your consent for a list of antihistamines and instructions. Prior to shots, notify a nurse if any of the following are true. If you have a fever, 38 degrees Celsius or 100.4 Fahrenheit, cough, wheezing, diarrhea, shortness of breath. Having an asthma flare-up. Had large local swelling at the injection site that are larger than a quarter. Had a systemic reaction, any symptoms outside of the injection site, after your last shots. If you are on an antibiotic for a respiratory infection. If you are on a beta blocker, metoprolol, propranolol, bisoprolol, atenolol, carvedilol. If you are unsure what a beta blocker is, please ask a nurse. If you are having additional allergic flare-ups of any kind. If you are pregnant or planning on becoming pregnant. Treatment of symptoms and/or adjusting your dose prior to your next injection is important for your health and safety. After allergy shots. Patients need to wait for 30 minutes in their car in the parking lot and come back in the clinic if symptoms occur. Most serious reactions occur within this 30-minute time frame, although some can be delayed by hours. On rare occasions, patients may be asked to stay longer for continued medical observation and treatment. If a patient chooses to leave the clinic prior to the 30-minute waiting time, they are doing so against medical advice and accept all responsibility and liability for any subsequent reactions from allergy shots. If a large amount of redness, swelling, and itching occur at the injection sites, use ice compress and discuss with nurse at next shot appointment. Do not call the clinic as this is a normal reaction to allergy shots. If systemic symptom occurs, any symptoms outside of injection sites, after patient has left the clinic, patient should immediately use an epinephrine auto-injector and call 911 or have someone else drive them to the nearest hospital. Can also call the clinic during business hours for advice. No exercise 30 minutes prior and 4 hours after injections. This increases the chance of systemic reactions. Cost and charges. If you are getting allergy shots at a clinic other than Iowa Allergy, you will be charged a shipping and handling fee of $7 about once every 6 months or whenever we ship out a new set of vials, not covered by insurance. Shipping is required if you are getting your shots at a clinic other than Iowa Allergy. You will be required to keep a credit card on file to be charged for shipping and handling, or you may choose to put a credit on your account instead. Each vial is charged for the anticipated number of doses. There will be extra serum in the vial, which is used for dosage adjustment purposes. If serum is used beyond the charged number of anticipated doses, then additional doses will be charged when a refill is given. The serum is unique to each patient. There will be no refunds for unused serum. It is the patient's responsibility to notify the office prior to new vials being mixed or if they wish for their vials to be sent to a different address. It is the patient's responsibility to notify the clinic that they want to discontinue their subcutaneous immunotherapy, allergy shots, prior to new serum being made and charged. This video discusses the allergy shot consent in detail. Please take a copy home with you and ensure you fully understand it. A nurse or provider will be in shortly to take your consent and answer questions. Thank you for trusting Iowa Allergy for your medical care.